firstly call upon Mr. Chandra Mouli sir uh, onto the stage. Chandra Mouli sir is the founder and CEO of CARE Health Tech Service Private Limited. He can brief.
Okay. So good afternoon, everyone. Once again, my name is Chandra Mouli. I'm the founder of CARE Health Services. Before I get into the pitch, I'll just give you a quick introduction. Um, I basically belong to. I've come from West Godavari. That's where I was born. Most of my schooling happened in Hyderabad, and pretty much with the work experience, I worked in Bangalore for several years. I was in the EdTech space, educational technology, right? That's where I was selling content to some of these big startups and IT companies. Uh, Around after working in the EdTech company, I decided I need to do something different. It has been a prolonged experience, so I I moved to Ireland. Then I wanted to kind of study there and probably pursue something else different. But I think things turned around and the COVID hit when I landed there. So I physically was there, but basically kind of arranging like joining the virtual session. So that was the kind of sad situation it was. But later on, I think during COVID, it made me realize there is a lot of things which need to be done at the ground. And luckily, my father-in-law is a doctor who worked in the obviously he's a senior physician in a rural village called Jaipur. It's just 5 hours from here in the Koraput district in Odisha. So he worked there for several years, and based on his experience and some of the gaps, I realized that we need to do something in this area of healthcare. So that's a quick background. Sorry, I had to give you. So just to quickly coming to this idea is it's basically it started like as you all know, right? Telemedicine was widely used. Everybody knows that the telemedicine was widely used during the COVID times, right? And everybody got, I would not say not everybody, only like the cream of the society, they call themselves like 30% of the 35% of the people were able to utilize it because they were equipped with the devices and they have the knowledge to connect to a doctor. Unfortunately, the same thing was not transferred to the rural communities, right? Many rural communities had no clue how to do it, and they suffered a lot mainly during the COVID times. So then we decided the future of healthcare is everybody is talking about telemedicine, and it is indeed going to be the future of healthcare. But how do we make the rural segment to utilize this advantage? And frankly speaking, when you see this, you will realize that it is more needed there than in the urban areas because in urban everybody has access to everything, but in rural communities it's completely different, right? So that's the reason why we decided to start this startup. So I'll not take much of your time. So I'll just, as you can see, by the Forrester that it says the next decade of healthcare is primed for seismic disruption by hospital at home. Basically, the care will be delivered at home, right? That is going to be the future. I don't know. Probably even surgeries can be conducted at home. I'm not saying, or probably near home. Future of this industry. So to highlight the problem, this is the problem statement what we are looking at. If you see today, nearly almost like every PHC, which is almost like 7 to 10 kilometers away, none of them have a specialist doctor, right? So what they find is probably an ANM, which who's basically a nurse, right? Other than that, they don't find any senior specialist. And if they even go to a community healthcare center, which is again 25 kilometers away, and nearly 67% of them also do not have a specialist doctor, right? So, and as you know, 60 almost 70% of Indian population live in rural areas. So much of the inventions, whatever AI, ML, everything we are talking about, it is all only done for the cream of the society, right? That's how it is. So now this is the problem statement, and as you can see, there are some of the patient profiles who can't even go to a nearest PHC as well. I mean, they are almost immobile, right? They utilize. So what we did is we devised a solution where we bring assistance in between, right? Where we call it an assisted telemedicine. So the whole concept is uh, so a health worker who is based in that particular society, right? Or probably he's in a village, like a health worker is living in a village of say 10,000 people. So certain or somebody who will be able to even do some medical checkups or physical checkups as well as and when required, right? Maybe she can check their vitals, probably do some physical checkup if at all it is advised by the doctor, right? So some of those things can be addressed. So this is the, I mean, I would not say the only solution, but we felt that this is a way wherein the specialist doctor is becoming immediately accessible to that rural community member, right? They are able to consult to a senior doctor, and the local person who is basically a health worker, he is able to guide them through the entire process, take their vitals. See, ultimately, what you need for healthcare, you need a proper diagnostic of a person, right? And if the health worker is able to find out everything about the patient, their current condition, their previous issues, their current vitals and their current problems, if that can be communicated very well to the doctor, so they can easily diagnose and probably identify the problem and provide them the solution, right? So that's the way we have devised this solution. So sorry, I'm taking too much of time. Generally pitching doesn't allow us to do prolonged sessions. We have like very limited time, like 5 minutes, 3 minutes, and so on. But for the sake of benefit, I was, because most of them are students, so I thought I'll elaborate a little more. Uh, so I'll go quickly from here. But so benefits are multifold, right? It is personalized care by the health worker, because if it is a society member who is there in that village, then actually they'll believe in them, and obviously they'll also adhere or start using this model, right? It'll also reduce the cost. It gives them access to renowned doctors instantly, right? And for doctors, it is simplified because most of the doctors, as you know, in the cities are overused, I would say, right? They are busy, they can't really have time. But if somebody is on the ground, is helping them with all the things, they are preparing the patient with whatever they needed, they probably would need just 5 minutes of their time to quickly understand the patient condition and prescribe, right? So for doctors also, it is simplifying the job. uh, a health worker is able to make a additional income, like if at all there is a model. Then for a health worker, as I said, yeah, employment opportunities. It is helping them make personal visits. They can actually go to the houses of the family members or the rural communities and conduct these uh, health checkups. So what we did as a startup, so we built a platform, but we did not address it to the rural communities. We instead created an app for the health workers. So ideally, there is a app which is designed for health workers, who could be nurses, counselors, ASHA workers. Also, we are actually trying to work with Government of India to see how we can actually bring in ASHA workers across India. As you know, right, there are many who are penetrated into the system. So we are looking to work with Government of India on that, on those aspects as well. But ideally, as I said, we build this system. And just a quick highlight on the experience. So we made it very simple. We don't want to complicate for the health worker also on the ground. So as soon as she opens up the app, she'll be able to see, like basically she can create an appointment, she can select a doctor, basically punch in very few details about the patient, then just book an appointment. And before the actual consultation starts, she can actually update some of the vitals of that patient. By the way, right now it is all manual entry, right? But in the future, probably we'll be able to automate that through some device and everything, right? That is all, technology can be evolved over time. And for doctor, it is also similar experience on the other side. She can get into a call, she can track all the patients, she can also check all the vital details, and she can also upload the prescriptions right into the system then and there, right? And we also built another app for patient, but with an assumption saying that most of these people will not carry a smartphone, or neither they have access to it, right? So but in future, whenever they have one, whenever if they punch in the same mobile number they have given during the registration, they'll be able to retrieve all that details, like what was their consultation was all about, what were the medical records and all that. And now that we are also integrated with this Ayushman Bharat digital mission, so now the health worker can also create an ABA ID for them on the ground. So that is something we are working with the Government of India on some of the projects, upcoming projects very soon. That's where how we want to connect with the ASHA workers as well. So because it's obviously a health worker, by name Gansham Mishra, and he has done all these consultations. And by the way, these are all real consultations where he was able to connect to specialists like oncologists, neurologists, all these different pediatrician, gynec, right? Those are the specialists which are really needed on the ground. They are able to connect to these patients, right, with the help of that one nurse. So all this is again some technical details on the kind of data we are capturing, how the tracking ENY I have not listed here, with a lot of pro bono consultants. So whenever you do a social related project, you will always get a lot of support from corporates like ENY, SAP, and one of these called Moving World. So there is always support which is given. So you probably can look for that. So landscape again, I'll just switch. Basically, we are actually closely competing with eSanjeevani also, right? Because eSanjeevani is also a platform which is basically driven by Government of India. So they also looked at our platform. They realized the gaps, and they are happy to adopt our platform also. So we have been able to do those conversations also at the ABDM level. So as we are a technology based company, we are trying to improvise, bring in new areas of concepts, right? So one of these is the video vitals. So very soon we will be able to incorporate a model where just looking at the camera, you'll be able to identify the vitals of the body, right? We'll start with the blood pressure. Uh, I know this may not be accurate. It may take several months or years probably to get that accuracy. But because we have healthcare workers who are doing physical checkups for the vitals, right? So always we can compare. And when we find a maturity, then this is the valid data where we can actually, I mean, we can believe this data. Then I think we'll be able to systematically put it in place. But otherwise, we need to take a lot of, I would say, approvals also from the government. But this is the technology we are building. I'm not getting the traction of it. It's just been a year right now. So we have been able to do some good traction. We're also bringing in some new models where we're targeting even the senior societies. Just like the rural areas, there are senior societies who are also not incapable or immobile to actually go to a hospital, right? So these are some revenue models just for your understanding. So we are even giving our platform to other players who are running physical clinics in the rural areas, right? We are giving them. We are also providing doctors. Like for example, if there is a pharmacy or a I would say diagnostic center in a rural area, and they want to have access to doctors for their population, so they can actually use a platform, and then they can start consulting. And that's the exactly what is happening. So some of the examples which I showed earlier was actually that model. And yeah, so right now we are working on rural and senior living. So we are also collaborating with several NGOs across India. We are giving our platform to them because ultimately for us, NGOs are doing a lot of work on the ground with regards to social welfare. So we are trying to bring down the cost of implementation for health programs. So that's how we are collaborating with them. And some very large global foundations like Miller and Moving Worlds and all are also part of our association. So these are some basic, not basics, some of the snapshots of the rural clinics penetrated into the interiors of the societies. And these are some very few partial list of our partners, some awards, and all that, and some great testimonials we received. Uh, yeah, I think that's about it. Thank you so much again once for your time. Yeah, please. This one. Okay. Yeah, yeah. Correct, correct. So see, all these guys are. So these guys have actually been in the system for several years now, and typically their model is they are creating additional TV screen and all that, right? So they are creating those setups. Obviously, many of these players were on that model only most of the time, but they are also adopting the technology piece as well. But having said that, uh, the penetration is, I would not say, is not as great as it seems. So it's just started since COVID, right? But still, we there is a lot of opportunity, I would say. Yeah. Yeah, urban there are plenty. Like yeah, like Facto, all these are telemedicine players, right? But these guys are assisted telemedicine players, I would say, where they have a in a rural village they have a small shop, I would say, where they'll set up a TV screen. They will have a nurse, dedicated nurse, who will be able to connect to a senior doctor in the city. So that's how they are working. But what we are trying to do is we are trying to make it more mobile, where you can actually go to the patient house, right? You don't have to make them come to your clinic, right? That's the idea. Any other question? So right now, as I said, right, what we are advising is use a tab, right? Basically, a proper full screen tab. You can actually go to our website. There's a demo as well, how they are actually conducting the whole telemedicine. Uh, so you can go to care.in, CAARE.in, right? So right now, we don't have that problem, but network obviously definitely it's a challenge. But before launching the platform, we did extensive studies and research and all. We went to the self-assist. Yes, yes. Yeah. So I mean, it is self-assist, but probably it is slightly biased to us. So I would say, but yeah, basically. I we did this based on the primary factors on their existing business model, right? So obviously they are not convenient because they are just like a PHC where people have to go to that place. So we are bringing in that convenience, so that is already taken. But how expensive they are compared to us is something we are still negotiating. But as I said, slightly biased, and we put in our cells on top. Yeah, feature based. I think we are better and all that. Yeah, so we actually did that. So as you can see, this is more of a detailed landscape of that. So right now we are actually running two models. One is in the rural and the other is the urban, right? So in the urban is obviously it's a model where a lot of revenue scope is there. We have already started doing that. I mean they cannot pay for the expenses. So we are identifying those pockets where there is a I would say footfall of the patients. And so right now, as I said, we are identifying those diagnostic centers. So for us, he's again my friend in Ireland. So I mean, obviously, it's all like friends. Most of us friends actually. So that's the reason. Otherwise, if you have to, sorry, yes, yeah. So actually, is there internet in this? Okay. So I mean, just for everyone's sake, it's not our side, but okay. So the technology has been already proven, right? And proven in the sense it is already being implemented. So this is a startup in Israel. It's an Israel-based startup where they are able to collect video data and check the vitals, right? So you can see the video is checking, and you can see some parameters down there where it is doing the quick check on the so there are like several things like it can do. Yeah, these guys are obviously, yeah, they provide SDK or API. Yeah, so which you can integrate with your app if you want to, but they are very very costly. So yeah, 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 correct, 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 correct. So right now, I don't think. I mean, they do have some measures where they check anxiety, fear. So those things are there. Yeah, correct, correct. Yeah, yeah. So they are obviously HIPAA compliant. I think they also got some certifications. So these guys are big, but right now they are primarily working on the vitals like BP. obviously not sugar, BP, blood pressure, SpO2, respiratory systems, everything non-invasive. Nothing is like touched. So just the video camera, they are able to do it. And I mean, they claim that they have been accurate, but I don't know how far it is. But again, as I said, it's something we cannot depend on it completely. That's the reason, as I said, in our model, it is more of a blend, right? Where we have physically a person there on the ground. So he's doing manually checking and manually entering it. And then when we bring in this concept, so it can cross check and verify whether how accurate is this, right? So that's the idea. So we are right now at only one parameter. I think ideally uh, by next month we could introduce where somebody uploads a video and it does a quick, like, you just record your video for 5 seconds, upload that, and then in the back end the system will actually do a quick check and give you that state as data, for example. So this is our website. So just go to care.in, CAARE, as I said. So you'll find some details about our model and some of these, and anyone who wants to understand how does it really work. So so this is the rural area again. Okay. Okay. So that guy in yellow shirt is the health worker, and he's able to do it. It looks like a fancy place there in the rural side, but yeah, that's it. And some anything on the video vitals, there is one video also.